I'm Dr. Kamal Balla. I'm a consulting physician at Malathi Manipal Hospital. I'm going to talk about diabetes, which is a very common disease, still emerging, and the disease which we are seeing very commonly in younger and younger population. We see that the awareness about the disease is increasing, but still the vast majority of these patients who are diagnosed are still uncontrolled, which is because of lack of awareness of the treatment, the need for continuing to the treatment, and certain myths which people feel about the medicines. The first thing that we need to remember about diabetes is that it can be without any symptoms. People say, I do not have any symptom, why should I take medicine? It is not the case. The thing is, diabetes in the initial part will always be asymptomatic, that is, without any problems to the patient. It causes you problems only when the sugars have increased beyond a certain level. The symptoms that we can associate with diabetes are usually weight loss, weakness, increased frequency of urination, especially in the nights, and increased thirst. These are the symptoms which appear, as I said, late in the disease, not in the initial phases most of the times. The only way to diagnose diabetes in the early stages is to have blood tests. To diagnose diabetes, we need blood tests. We cannot rely only on symptoms. The tests have to be done, and they are simple blood tests which can be done in fasting and after food status in any of the labs. A random blood test may not always be accurate as far as diagnosing diabetes is concerned, so it's always advisable to do a fasting or 2 hours after meal test so that we can get accurate values and the diagnosis can be made accordingly. There is also a 3-month average sugar test. It's a simple blood test which you can give in one sample, and it can pick up how your sugars have been on an average in last 3 months, which is a very good tool to monitor patients who have been known diabetes. That helps us in the control of diabetes in such patients. It is important to do blood tests for certain group of patients, especially if you are 40 years or above, or if you have a family history of diabetes. Anybody in your family, in your close relatives has had diabetes gives you a higher risk for developing diabetes, and that too at a younger age. Once a person is diagnosed with sugars or diabetes, we have to make sure that they are put on adequate treatment. Now, the treatment to begin with consists of diet control and exercise. There is no need to get scared of diabetes. It is very well controllable. But we have to be aware of the treatment options available, and we have to take the treatment accordingly and do a regular follow-up with the doctors. Apart from diet control, exercising is a very important feature which is required to control sugars. Exercising could be in any form. It could be fast walking, it could be cycling, it could be jogging, it could be a treadmill, anything. But fast walking is something which is very convenient for most of the people and can be doable. A fast walking of at least 30 to 40 minutes every day keeps sugars under control to a large extent. And this is the most important thing that a person with sugars has to keep in mind. All patients may not be controlled with diet and exercise alone. Most of the patients will need some kind of medications, and it is important to start them at the right time. There are a variety of medications available in the market now, and all of them are safe. One has to remember that diabetes increases with age, and your requirement of medicines may also increase with time. This has to be kept in mind that sugars may need control with further and stronger medications and insulin with time, and it is utmost important that the sugars are kept under control. There is no high or low dose of medicines for any patient. The medicine dose which controls your sugars is the correct dose. Some of the patients may also need insulin, and there is no need to get worried or scared about insulin. Insulin is a safe medicine and has to be used if your condition warrants. While taking these medications, if your sugars are under control, you can lead a perfectly healthy life without any restrictions apart from diet. So it is important that you control your sugars well. Most of the patients ask me, I am fine, I don't have any symptoms, I'm taking medications, but my sugars are not under control. What should I do? I always tell them that if your sugars are not under control, there is a problem with your diet, your exercise, or your medicines. If you are doing good diet control and exercise, then we need to adjust medications. There is no way your diabetes cannot be controlled. It can always be controlled with adjustment of your medicines. Uncontrolled sugars can also lead to infections across your body, the most common being infections in the urine and kidney and in the skin or boils. A comprehensive diabetes care, especially for advanced disease patients, will need multiple specialities to be involved, including a neurologist, a nephrologist, an endocrinologist, dietitians, and sometimes even surgeons for infections of the skin. The last but not the least thing that I would want to say here is a regular follow-up with your physician is very important in maintaining the control of diabetes. As I had said earlier, the diabetes will progress with age and your doses need to be modified, which can be done only once you are coming for a regular follow-up with your regular physician. Comprehensive diabetes care involves treatment from various specialists, including physicians or endocrinologists, dietitians, neurologists, nephrologists, and sometimes surgeons, especially in advanced cases. And these all facilities are available at Malti Manipal Hospital, Jayanagar.